Okay, so you know what? It's Monday Makeover Monday time. And what about a manly makeover? Because men, we need to make over ourselves too. I'm joined at the table with Dr. Peter Capizzi. Capizzi, thank you so much, because we're talking about something that is sensitive for a lot of men, and that's hair loss. Now, I was talking to you. I shave mine by choice, but a lot of my friends, they have gone into that place of insecurity because of hair loss. How can you help us?
Well, the newest thing we have, and as you can see, I haven't shaved my head by choice, is Neograft. That's instead of removing a strip,
like parchment paper or like greased
specific follicles.
I have some more.
We plant them in the hairline, the male hairline. So they're very concerned about hair.
Yeah, because in right now, the weather is getting warmer and more men are going to be outside. And that's really where a lot of men are insensitive and have those sensitivities that come in because of the summertime.
That's correct. They don't like hair. They're either don't like hair on their back, or they're worried about not enough hair on their head. And the folks about my age are worried about correcting it. Folks that are younger are worried about preventing it. And so if they see their family, what they're headed toward, and they don't like it, Neograft is a good way to do that. And they can do it awake and while they're watching Netflix, basically, in our office.
Yeah, so let's show our morning breakers kind of like some before and after pictures, because you use something which is called cool sculpting. And we're seeing on the left here is before.
Correct.
And now we're seeing after.
Correct.
Let's call for the next picture too. And as we're looking at these pictures, can you explain the process that takes place?
Sure. On the left side, that's a male pattern baldness. We'll take the specific follicles from the back of the hair and the back of the head with a closely cropped haircut, and then remove them and actually place them in the front area. That would be on the right side. And you'd see that, and you'd see it immediately. It's not something you have to wait for. It takes about 2 weeks till you can wash your hair.
Now is this a one-time procedure, or are there a few procedures for men to come back and get this done?
So most often it's a one-time procedure. It depends on the amount of baldness. So on average we'll transfer about 1,900 grafts, and that will take probably 4 hours.
Now this is drastic here.
That's correct, and he might need a second treatment.
And how would a man know if they need a second treatment, that we can still see that there's some thinness here on the after
Correct,
picture here?
And it would be to increase the density of hair over time. And so someone that has that amount of baldness might need 2 treatments.
And how long is the procedure once they come into your office?
About 4 hours. That would take about 4 to 5 hours. Okay,
so now there are some morning breakers that are watching right now, and I know a lot of women are watching, and they're saying, my husband needs this. I mean, seriously,
yeah.
How can someone start the conversation that leads a person there to admit, hey, I do need to do something about this?
Well, they can call our office for #1 and ask to speak to one of the providers, and we can discuss that with them. And they'll want to seek a medically trained place for this type of procedure. And there are at least 2 in this city.
All right, and where can folks find you?
I'm at Capizzi MD, Cosmetic Surgery and Skincare. Check out our website, capizzimd.com.
All right, thank you, doctor. We appreciate the knowledge.
Coach.
All right, we'll be back with more Morning Break. Please stay with us.